The Big Squeeze by Charla Wright. I'm finally able to retire, travel, and do what I want. Those words have little meaning these days for many retirement age people who care for their elderly parents and are supporting adult children in some capacity. Some retirees are even raising their own grandchildren. The old phrase, it takes a village, has a whole new meaning in this millennium. No more are the days of retiring at the young age of 55 and beginning new adventures kid and parent free. Nowadays, it takes an entire family and support system to help raise and support both the adult children and the aging parents. Sadly, even if you have support, the stress encountered by the day to day drains can be overwhelming to many caregivers. Take solace in knowing caregiver burnout is all too common. In the 2020 National Alliance for Caregiving and AARP Public Policy Institute survey, 40% of caregivers felt emotionally stressed, almost 20% said it caused financial problems, and about 20% felt physically strained. Personally speaking, we still have adult children we support, and now we also have the parents to support on a daily basis. On paper, it doesn't sound like anything too stressful. However, if you look at our calendar, it is full of doctor's appointments, shopping trips, picking up prescriptions, paying for insurance, school, cooking, and cleaning. It's difficult enough in our own homes to keep up with all the daily demands, but multiply that by two or even three different households if your parents are divorced. So, the elephant in the room is how do we manage to maintain sanity while caring for our extended relatives? Although difficult to do and often hard to say, our own mental and physical health needs must come first. We cannot be of any help to those around us if we are sick, depressed, or stressed out. There are some measures we, as caregivers, can do for ourselves that are simple and preventative. For example, stay on top of your own annual checkups with your primary care physician and dentist. Take mental health days for ourselves and indulge in our hobbies. Or if you are not able to get away for a whole day, be sure to take an hour and go for a walk. Join a support group. Listen to a podcast or relaxing music. Sit outside and catch up on your favorite novel or try a new recipe. Caregiving is not for the faint of heart. It can be a marathon. Be on the watch out for symptoms of caregiver burnout, such as irrationality or irritability, lack of energy, not wanting to be around people, depression, feelings of hopelessness, lack of appetite or weight loss, or exhaustion. Many more symptoms go unnoticed because the burnout may mentally affect day to day activities. Whether you experience mental, physical, or emotional symptoms, be sure to reach out to your medical provider immediately. Okay, you sought assistance from your medical provider who is able to help you get back on track. Now, what do we do to get help with caring for adult children and aging parents? Depending on the community you live in, there are several avenues. For elderly parents, try reaching out to your local senior resource center or senior information and assistance. These resource centers are funded by the state and county and receive monies to fund some of the support they offer citizens of their community. If the aging parents has dementia, there are daycare opportunities at local memory care facilities. Dungeness Court Memory Care in Squim offers a daycare option for drop-ins. It charges a nominal fee, and the caregiver gets a whole day break while the loved one receives new stimulation through an engaging environment. For adult children, there might be more involved, especially if their grandchildren are in the picture. Professionals advise a family counselor to help delineate and work through boundaries with adult children. Yes, it might be time to cut the cord. It might be a slow process to ensure a healthy separation. I can only speak for myself, but I know I could be on the slow boat to China when it finally comes to moving my adult children to independence. For more information on how to help and empower yourself, please reach out to friends, family, and professionals who you know and trust. Living the big squeeze is much more common than we realize, and we are not in this situation alone. Remember, it takes a village.